Aneurysms are just ticking time bombs in your body that you cannot feel. And you may be wondering, if we're all just living with the risk of having a blood vessel burst open at any time, surely there needs to be a better way to tell without necessarily having a CT scan. And unfortunately, there is no other way than to do a CT scan. And I don't know about you, but those aren't very accessible. And one of the most dangerous types of aneurysms is an abdominal aortic aneurysm, which is what happens when there is a weakened part of your artery around your abdomen or your stomach area that becomes weakened and may burst open. And if it does, it becomes a critical medical emergency. And so in the early 90s, a group of very radical surgeons decided to find a way to fix this aneurysm before it burst. And that's how they were able to test something known as EVAR, or endovascular aneurysm repair. And the way that they do this is to put in a tube or a stent to create a different tube that will be able to protect that weakened artery from rupturing. Or even if the artery eventually ruptures, then there is a secondary layer of protection from that tube that was inserted. And this simple technique has been able to lower the complications of aneurysm ruptures and also just help those that eventually rupture to recover a lot faster than normal surgery would have done. The long-term trade-off, however, is that if you undergo this procedure, then you will just have to have a lifelong, then automatically you'll have to go into the hospital for the rest of your life to monitor to ensure that there are no leaks. But if you're somebody who is over 65 and you have a family history of people with aneurysms, this seems like a better alternative than waiting around and finding out.